Hello, my name is Leslie Ochoa.
My name is Rosalinda Ochoa.
And I'm Athena Vega, and this is our presentation on coronavirus vaccines.
COVID-19 is a disease caused by the coronavirus, and it appeared for the first time in December of 2019. It was declared a pandemic in March 11, 2020, and the coronavirus can be asymptomatic, which means you may get COVID and not have any symptoms, or it may cause flu-like symptoms such as fevers, chills, headaches, and sore throats. These symptoms may appear for 2 through 14 days. Individuals whose immune system is compromised, such as older people or people who have underlying health conditions, may suffer more and may be hospitalized if they get infected with this disease. And this is due to the fact that they have a weakened immune system. COVID-19 is spread through airborne particles. That is why it was very important to wear masks and stay away from each other during the pandemic. And the 3 coronavirus vaccines we will be discussing are the Pfizer vaccine, Johnson & Johnson vaccine, and the Moderna vaccine.
The Pfizer, Moderna, and the Johnson & Johnson vaccines are all structured and work differently. The Pfizer and Moderna are messenger RNA vaccines. The way these vaccines work is that it gives your cells instructions on how to make the S proteins that are found on the surface of the coronavirus. The S proteins or spike proteins work as receptors on the coronavirus surface. These receptors help other cells recognize each other. They are similar to identities. These spike proteins are also used to help the virus penetrate and infect other cells. Once the virus S proteins are made, after being instructed by the vaccine, your body starts to create an immunity against them with antibodies. Antibodies are a part of your body's defense system. They fight against any foreign particles that enter your body. The Johnson & Johnson vaccine is a vector vaccine. This vaccine works a little different. Instead of instructing your cells to create the S protein, the vaccine itself has material from the coronavirus. The material then instructs your cells to make the S proteins and then make your antibodies to fight against it. The vaccine does carry material from the coronavirus, but that does not mean that you will be infected with the virus. The material is harmless and is just used to create antibodies against the virus for when or if you do happen to get infected.
Before COVID vaccines were available, the World Health Organization declared the coronavirus a pandemic. This means that the coronavirus was infecting people all over the world. Being that there were no effective treatment options, people got severe symptoms from the coronavirus, so there were high rates of hospitalization and death. Because the hospitalization rates were so high, hospitals were understaffed and were running low on supplies, further limiting treatment options and making successful recoveries of those infected more difficult. According to the Centers for Disease Control, or CDC, COVID-19 was the 3rd cause of death in America. As a result, many states issued home mandates, which limited people to leave their homes only when necessary. This also closed down all non-essential businesses to help control the virus's spread, which caused more than 26.5 million Americans to lose their jobs and others their health insurance. Once the vaccines became available and people started getting vaccinated, the CDC found that the Pfizer and Moderna mRNA vaccines were 90% effective in preventing healthcare workers from getting COVID. This was important as healthcare workers were constantly getting exposed to the coronavirus by their patients. Furthermore, the CDC also found that those unvaccinated were 5 times more likely to get COVID again than those vaccinated. Even when vaccinated people got infected, they were more likely to not get severe symptoms, decreasing hospitalization and death rates, and having a greater chance of survival. This then allowed states to remove the mandates to go back to a sense of normalcy. While the vaccines proved effective, many did not trust them as they were made quicker than other known vaccines. With each COVID vaccine, there were some rare effects found. With this, many people began throwing the occurrences out of proportion, which also contributed to vaccine hesitancy and false information spreading. People began worrying whether they had tested the vaccine's effectiveness long enough to know that it would not cause any harm. However, even the most common adverse effect only occurs 1 out of 1 million doses, so the benefits of the vaccine far outweigh these odds, as can be seen by this image.
Our question was, a patient comes into your clinic and wants to learn more about the COVID-19 vaccine. The patient states that they were already infected with COVID-19, so they believe to already be immune to it. Determine which would be the best action to take to inform your patient on the COVID-19 vaccine. And I'll say the answer in 5, 4, 3, 2, 1. The answer is B. It is important to inform the patient how unvaccinated individuals are still more likely to become reinfected with COVID than those vaccinated. Vaccination provides added protection and decreases severity of symptoms.
To conclude this presentation, it is important for individuals to be well educated on the COVID-19 vaccines so that they do not only keep themselves healthy, but also the public. The coronavirus vaccines all help decrease the number of cases, deaths, and hospitalization rates, as well as lowering the risk of getting severe effects if infected. It is important to stay up to date with any boosters so that you stay protected and prevent any serious illness from this disease. This concludes our presentation. Thank you for watching.